So when we're talking about setting a date to go back to school, let's be realistic about where we are. We have a long ways to go before I feel like the metrics would be safe to return to school. And I hope that would only take 6 or 8 weeks. I mean, we've had a drastic downturn, but I'm not looking just for a downward trend, because we do have a downward trend for the last month, but we were the worst in the world at the end of June. So I need a downward trend and a minimal number of cases to feel safe about reopening schools. That is kind of my point.
I can appreciate that, Ms. Humpherys, but I also think, again, if you're going to say we're going to rely on the data and the experts, then that's what you have to say. That's what you have to go by. You can't
and I would
qualify that with then deciding not to and putting an arbitrary thing on it. So that's my concern with
I guess
that
my
approach.
concern is right now I'm not trusting the governor very well. That's my problem.
Well, but how? But then how are
that's putting
you
politics
qualified then?
and your feelings first.
How are you qualified then to discern the data? I'm just trying to say we have to agree on something.
People who have put out those sort of plans, and when I get the governor's plan, I'm going to compare it to what some other people have suggested, other people who are also experts. I know it's my feeling, but it's also my objectivity. The governor has not led in this pandemic in helping us to get safely through, and he hasn't always followed the data as well as he should have. And the opening in May is a great example. So
I am grateful that the governor has set aside his own opinion and delegated this to experts in the Arizona Department of Health.
And I hope he gets it right.
He's trying to set aside those politics and follow the experts, which is what our teachers have called for and our parents have called for. Let's use the data and put aside our feelings, please.
I am using the data, Mr. Carr, and what I'm saying is the data that I looked at says we have a long way to go before it would be safe to go back to school. I mean, as far as the number of cases per day, that's the data I'm looking at, the number of cases per day and the number of cases per 100,000 residents. That's the data I'm looking at.
And Ms. Humpherys, what expertise, science or medical, do you have for setting that criteria in lieu of deferring to those who have expertise and work for the Department of Health? Because right now I'm saying I'm willing to put aside my feelings, my preferences, my politics, and follow the data. That's what I'm asking us all to do. I'm not taking my opinion of when it's safe. I'm deferring to the experts as we've been asked to do.